You're listening to the UBC Medicine Learning Network.
I've never been given or had access to a health advocate ever, even though I clearly have just complex health issues in general. But I've never, as a person who clearly has barriers, has had someone that was actually advocating for all areas of my health, which could have sent me on a different trajectory, a more positive one perhaps.
From UBC Medicine, this is The Listen, Stories of Virtual Care in Context. I am your host, Dr. Kiran Veerapen. Today, providing accessible and inclusive patient care. Although care in our province is available to everyone, it's not always truly accessible to everyone. For patients with unique health issues, advocating for one's needs can seem like an impossible mountain to climb. Our patient shares how inaccessible care can be for neurodivergent patients.
I was born in Prince George, and I was there until I left when I was right before I turned 18. I had a traumatic brain injury when I was 3 that completely changed my personality. It was a really bad concussion. I was vomiting, I was blacking out. Later on, I got a diagnosis of high-functioning autism spectrum disorder. I always had issues with depression. I can't remember a time in my life when I didn't, due in part to the head injury, but 100% due to developmental trauma. So growing up in an abusive, neglectful household. Mostly what it resulted in as a person with a female body was more that I was blamed for having bad behavior and that it was my fault that I was experiencing mental illness. And therefore, I had to fix my behavior, period. And it was just suck it up and just do it, right? But there's no looking at what the root cause of the behavior was. We've got a very different framework for dealing with that now. The only thing that me and my parents were aware of was the fact that I was intelligent, did really well on intelligence tests, right? Super fast problem solver for anything, any logic-based stuff. If there was anything that was emotional, it was always more difficult. With the telephone stuff, this is my whole life. I had a really hard time with telephones, other than when I was a teenager and you just hung on the telephone for hours because it was the 90s. But with the telephone, I can only hear a voice and words. I cannot see facial expression or body language. I have a hard time with tone of voice over the phone, and everybody speaks differently. And everybody has different phones and different quality, sound qualities, right? So I have a hard time understanding what the words mean in the context of the conversation. Then I start just fixating on the words as individual words. And then I can't actually hear what's being said. I just hear words. And then I can't remember anything. I will just lose everything that was said immediately during and after the phone call, right? Even if I write stuff down, it's gone. But it's if I had been able to record my medical phone calls from that time period, there would have been a lot of things that went better for me because I couldn't remember anything. My memory is crap because of trauma. So I basically have a phone call. I've assigned meaning to words in a certain way. I've forgotten half the call. And I just basically have this sense of what was said. And that becomes my story of the phone call, right? So it's my story of the phone call. It's not the actual phone call. It's not the actual appointment. It's not the actual meeting. And what the other person has is maybe they've taken notes, maybe they haven't, but they end up having their story of the phone call. And if they're in a position of power or authority, then my story then gets minimized and I don't matter anymore. And then parts of my healthcare were neglected. It would often trigger suicidal ideation because it's if I'm never going to get help, what's the fucking point?
While progress has been made to provide a more inclusive healthcare system, our next story proves there is still a lot of work to do. From having their identity denied to being rejected from care, our second patient, Alex, shines a light on the barriers and challenges faced by transgender patients.
My name is Alex DeForge. I use they and them pronouns. I identify as generally queer, but more specifically transgender. I was assigned female at first, but I don't identify with either being male or female now, so I'm non-binary. I see a lot of doctors, so we'll start with that. If everything is going super well with my health, I probably talk to like 3 doctors a month, perhaps multiple times a month. And that's like if everything's going perfectly. Something that I'm going through right now is I'm pursuing top surgery. So it means I'm also talking to both like my family doctor as well as specialists and like talking through that process and what it looks like and making decisions in there. With respect to being transgender, and I think that this is one of the interesting things about being trans in particular, is that gender is like a pervasive thing that we live with and think about and talk about in a way that even sexuality doesn't quite like hit the mark with how much we have to deal with it in a medical system or how much we have to deal with coming out. Gender is the thing that appears like in waiting rooms when you like are trying to find a bathroom, when people address you, when you're filling out forms. There's a way in which gender kind of happens and pops up at every stage of the process. But even things that have like absolutely nothing to do with gender, like I went and did laser eye surgery a couple of years ago, and like my gender came up and they didn't have an option for navigating. It was a private system, but they didn't have an option for navigating their system for someone that was non-binary. They were just like, we have male and female. And I was like, aren't these eyeballs? In order to get to an appointment, it's not just the barrier of like showing up, but it's like you have to leave your apartment and encounter like random strangers on the street who either might misgender you, or if they have perceptions of you being transgender because you look a certain way, or you actually might face transphobia or discrimination or harassment. You have to worry about getting on a public bus, having somebody say like,
"Excuse me, miss."
What I would call a microaggression, in the sense that they're not intended to be put downs or intended to make me or transgender people feel bad. But when you add them all up over time, it becomes a lot. And so by the time you actually get into your doctor's office and you're finally standing in front of the person that is like doing the front desk, and you get misgendered by them, or there aren't options of like what to check off, or you ask for a bathroom key and they hand you the wrong one and you're like trying to explain that it's not the right bathroom key for you. It feels like a lot. Like it's just this huge barrier. And then on top of that, you just don't know like what that final step will look like. And so it can sort of be this like an extreme anxiety producing journey with possibly a bad outcome. And so if you also can imagine feeling out of place and feeling like you don't belong in that office and feeling like every step of the way it's an area where you're rejected in public life and in a public institution, then that is kind of the journey of being a transgender person accessing healthcare.
Dr. Brent Ohata, who is a clinical assistant professor in rheumatology at UBC, recognizes the first step in providing accessible and inclusive care, which is prioritizing and validating your patient's concerns.
Really, at the end of the day, what we do as doctors is we have patients come into our office, which isn't going to happen if there's no trust. We ask them to take medications, which isn't going to happen if there's no trust. We order investigations, which people will not do if they have competing interests and they don't trust you. All of these things are contingent upon trust. And if you build that trust in the beginning, things flow so much better later on. You know, I think fostering those relationships and creating that close contact is really essential. In my experience, what patients pick up on is that you care. It doesn't matter if you're perfect. It doesn't matter if you put your foot in your mouth and make a horrible gaffe. As long as you show that you care, I think that's all that really matters. You know, I see patients who are marginalized for all sorts of reasons, and I make mistakes all the time, but there's this idea that guides me, and it's this concept of cultural safety. The premise of this is that you should be scanning the room and scanning the patient's feelings at all times to get a sense of how they're feeling and make sure that things feel safe to them at all moments. We all make mistakes. We all say the wrong things. If you make one of these mistakes and are attentive to your patient, you'll know. And I think the best thing about this is being forthright and saying, oh my God, I'm really sorry. I didn't mean that. Like, did I just say something horribly offensive? And if this comes with, a sincere heart, patients will pick up on that and there will be no harm, no foul. I think by far the worst strategy would be to just sweep things under the rug and pretend that everybody is the same automaton and that you can just practice factory medicine.
Although both patients have faced countless challenges during their healthcare journeys, virtual care has provided both with hope as they begin to experience safe and somewhat customizable care for the first time.
Like, being able to access virtual care makes things more accessible. Also, as a transgender person, accessing virtual care means that I don't have to encounter all those extra instances of being misgendered or transphobia or risks of harassment. I often recommend, if you can do it, which you can't always for all appointments, some appointments do have to be in person, but I'm always like, if you can do it, do a virtual appointment, because worst case scenario, you can get out of there by pressing a button, closing a laptop, turning off your phone, and you don't have to physically be in that space. And then you're possibly in a safer space. It also gives you the possibility of having a friend or someone that can serve as an advocate in the room for you without making that person travel with you. And a lot of the time through systems, there's a thing where you enter your name, and sometimes it allows you to enter pronouns, but a lot of systems don't always. But I just add my pronouns in brackets anyway. I shove it into my first name. My first name always looks like Alex, they, them. And it's a really nice system in the way that it's already built to signal to doctors what name to use, what the issue is, what medications you're on. There's this other part of the system that can be used to indicate some things about your identity. I don't have to go through all these extra steps of getting to the care provider that I know will treat me well.
I've been able to access a psychiatrist that doesn't live in my region within 6 months, when the waiting time to see one in person in my area, in my city, is 2 years. They've been very helpful and understanding and also very insightful into a lot of things. And so I wouldn't have access to that complex care doctor or any complex care doctor necessarily if it wasn't virtual. I think the main limit with virtual for folks with barriers, the length of time the appointment goes for, because a 15-minute appointment for a lot of people is not enough, especially when they're at home. They've got distractions. There's people that are taking care of children, or there's invasive animals. 15 minutes, you're not going to get what you need to get done in 15 minutes. Half an hour is great, but I think tailoring it to the patient instead of having standards is much more inclusive.
Like many medical students, third-year student Andy Wang has felt the pressure to conduct patient appointments efficiently. Andy shares his advice on balancing the need for efficiency with being caring.
I think the main thing to teach students is to understand before entering an interview what information will be beneficial so that there is progress being made. Also allotting time so that the patient can raise concerns or comments or questions. And then you can reassure them that it can be addressed that meeting or it will be addressed at a future meeting. So it's not that the patient feels oh, I'm being thrown off as a to-do list for another day. It's no, I just need some more time to sort of understand what we discussed, and then I'll be able to synthesize all that information so that I can give you an appropriate plan to best take your healthcare and progress it moving forward. It's key to be able to put yourself into someone else's shoes and empathize with them. Really learning what the patient is asking, what their true barriers are, and letting them have the stage and time to voice those concerns. And they look forward to the next interview and open up to you. And that's the goal, is that they begin opening up to you because you built that trust and you are putting in that effort to really listen to what is affecting them from a day-to-day aspect.
From its origins to today, Dr. Brent Ohata has seen virtual care's potential to eliminate barriers, build trust, and enhance the patient experience. He leaves us with some important best practices for virtual appointments and his thoughts on virtual care's next frontier.
Treat this as any other visit. Don't think that this should be necessarily a barrier to forging relationships with people. Try your best to connect with people by video as opposed to by phone. You gain so much more information simply just by virtue of observing their demeanor and their home. As well, there's huge amounts of the physical exam that can be performed virtually. So to do things by phone only is really to do a disservice to your patient. There's just much less of the physical exam that can be done. And as a consequence, you can end up skating on thin ice, so to speak, clinically by making decisions just based on phone visits. I personally believe that there's a lot of potential for virtual care to simply upend all of the models of care that we've adhered to for the past 50 years. These are really exciting times. A number of us have gotten together to create what's the beginnings of a virtual hospital where any family doctor can call a specialist in real time, get advice from the specialist about a patient that's sitting right in front of them. Accessing patients in real time with the family doctor present is just one of the most exciting things that we're working on right now. The message that I would offer would be try to be sensitive to people's needs and adapt, be creative, and be innovative about ways to reach people that otherwise have been marginalized. These people deserve care too, and it's incumbent on us to change the system so that we can deliver care to all of these people in all corners of the province.
Our goal as healthcare professionals is to provide each patient with quality care, prioritizing each patient by making time to listen, validate concerns, and understand their needs are the building blocks that lead to more accessible and inclusive care. I am Dr. Kiran Veerapen. This has been The Listen.
This has been a presentation of the UBC Medicine Learning Network.